To get a sense of how breast cancer care and service delivery is going in our province, we're joined by Health Minister Jeremy Cockrill. Thanks for making time for us, Minister Cockrill.
Absolutely. Thanks for having me, Sam.
I want to start out by asking you, if you were to rate how breast cancer care is being delivered in Saskatchewan right now on a scale of 1 to 10, how would you rate it?
It was something like that, Sam. It's hard to give a number just because, everybody's experience is a little bit different, depending on even where they live in the province as well. What I would say, though, is improving. And, when I look at what we've been doing in recent months and years in terms of getting the Breast Health Center in Regina up and running, continuing to work through the Breast Health Center in Saskatoon, some of the recruitment efforts we've had in terms of being able to train breast radiologists out of province and then bring them back home to Saskatchewan. I would say it's improving. It's not a 10 yet, but we're still working away on that.
Okay, from a ministry point of view, though, how would you rate it or how would you say that it's improved? I know that every individual patient's experience is going to be different. That's inevitable. But on an operating level, how would you rate it?
Well, I think the key piece around improving the improvements that have been made in recent months is really around expanding capacity, both on the screening side, and there's more improvements coming on that. We have a second mobile mammography bus starting up in January, and again, especially if you live in an outlying community or in the north. Rural community in the southern half of the province, that mobile mammography bus is really key from a screening perspective. But then the capacity as well on the diagnostic side. Once we get into the Breast Health Center, working with our partners in Calgary as well to make sure that services are available to patients. And then the key thing, going back to screening just for a second, is really lowering the age of eligibility. We're at age 45 right now. So if you're a woman who doesn't have a family history of breast cancer, isn't showing symptoms, starting now at age 45, you can be part of the breast check screening program through the Cancer Agency. And we'll be moving that down to age 40 by next summer.
So not going to rate it, huh?
Well, I'd say as I said, it's improving. It's interesting. I mentioned off the top, Sam, I think, or before we got on, I was at the CIBC Run for the Cure in my own community here on Sunday, and met women who are still going through their journey. Met women who are 10 years past conquering breast cancer, and so it's such a variance, I would say, for individual patients. At the end of the day, we're looking to lift the boats of all patients as they navigate the system.
Okay, you've mentioned the Breast Health Center in Regina a number of times. It opened its doors in Regina April 23rd to patients. Your government invested a lot into this, $8.5 million, which did include building renovations, diagnostic equipment, and staffing. Just about 6 months later, is it operating the way it's intended?
Yes, and actually, I think we're actually working now on the second phase of the Breast Health Center there in Regina, which will move the lymphedema program to that same location at the Regina Crossing on Albert Street. I believe now we've had about 1,200 patients be referred to the Breast Health Center since the opening in April. Really, if you've had, I don't know if you've had an opportunity to tour it, Sam, but it's really a great one-stop shop. Once you've had, say, a screening mammogram where there may be an irregularity, maybe you've been referred by a nurse practitioner or a doctor who's noticed something that warrants a second look, really having that whole one-stop shop. And there's no doubt that there's some people at the Breast Health Center who are going to be receiving some tough news. And I think, but having that whole support team right there in that location in one spot, I think gives women, especially in the southern half of the province, really the best experience possible as some of them start to navigate a challenging journey.
Do you know how many people are seen there every day?
I don't know the daily number, Sam. That obviously depends on kind of our referral pathway. As I said, about 1,200 patients by the end of my last numbers I have, about mid-September, I think we'd seen 1,200 patients there since opening in April.
What gaps still need to be addressed in the building? Are you still looking for very specific staff?
We do have a couple postings that'll be going up soon. Again, these positions are adding to what we originally had with our original staffing complement. We are fully staffed there now. Once we put these new positions on, really focusing more on the imaging side, again, will give us more imaging capacity at the Breast Health Center.
Back in February, you said the ministry was looking to add more biopsy and diagnostic procedures in Saskatoon and Moose Jaw. Has that happened?
Yeah, so we have been able to expand some diagnostic procedures. There, again, and this is all part of as we think about healthcare as a provincial system. Like think about for patients in Regina, maybe we have a little bit extra capacity in Moose Jaw. I know maybe not every patient has the ability to drive out to Moose Jaw. It's not a long drive, but so patients who do, we want to create that opportunity to go out to Moose Jaw if you're in Regina or if you're in the northern part of our province to access services in Saskatoon. Work continues. But again, this just speaks to, I think, the really value of having these two breast health centers and looking at it continuing to expand what we can do there.
So, to be clear though, did you expand capacity in those cities?
Yes, that's my understanding. We've expanded capacity in
Okay.
both Moose Jaw and Saskatoon.
I want to ask you about Saskatchewan patients who've been traveling to Calgary to aid in that diagnostic process. What can you tell me about the numbers?
Yeah, so as of mid-September, we've had just over almost 750 referrals, and then nearly 650 of those referrals have actually gone to Calgary for that diagnostic service. And again, I want to be very clear because I think this is, when I've talked to women around the province, I got to be very clear. What patients are being sent to Calgary for is not the typical routine screening program. That routine screening program, I think that's something that the cancer agency does really well here in the province of Saskatchewan. I mentioned the mobile mammography bus, as well as, we've got several sites all across the province where you can get a screening mammogram. It's again, once something seems amiss on that mammogram, or if you have a referral, that's where again, if we don't have immediate capacity in a community close to you, that's where the option to go to Calgary is offered. And again, there's some travel expenses covered as part of that.
Now, that started as a temporary solution in late 2023. You just gave us an update on the numbers. I know as of the end of March, we had 500 that were sent to Calgary. We're getting into late 2025. Why is this 2 years in still a solution?
Well, I think it's really about, in terms of adding optionality for Saskatchewan patients. Our current contract with the provider in Calgary does expire at the end of March in 2026. Between now and then, we're certainly going to review the numbers, review our agreement with them, and determine if we want to continue that or not. I guess, Sam, it's really about coming back to options, right? And if we don't have capacity, we have expanded diagnostic capacity in the province, as I mentioned, with a couple of radiologists coming back to the province, and that's hospitals or Regina Foundation have been a huge help in helping to support that effort. But again, as we continue to recruit and retain radiologists, I don't think it's a bad thing to have options for Saskatchewan patients. I think if it was my wife, if it was my sister, my mother going through that, I'd want there to be options for them.
But realistically speaking, someone who's received unfortunate news that they're going to be likely going through this very serious health battle, how likely is it that they want to travel all that distance, have to bring someone along, figure out the reimbursement process when they could just go to a clinic in or near their community that's not 8 hours away?
Well, I think the key thing is, when we started this arrangement with our partner in Calgary, we didn't have the Regina Breast Health Center open, right? And so that's always our preference is that, especially women in the southern half of our province, that we would be able to do all those services at the Regina Breast Health Center. As I said, the numbers there, we're starting to see some good patient movement through there. But again, it's about having that option. And I think as we expand the capacity in Regina, then we can maybe look at ending that arrangement with patients going to Calgary. But I think for a lot of patients, as I said, it comes back to options. Sometimes I think for patients, it's, obviously we want care as close to home as possible. But for some patients, they want to know as soon as possible. And if they can know a couple of weeks sooner by going to Calgary and they have the capacity to do that, why would we not give them that option?
What is the plan then going forward? What's your vision for this care plan when this expires? Would you prefer that we just have the capacity here? It has to be much less expensive to not be sending people out of province for care.
If you just compare the operational numbers, like the number that we have for within the SHA for this, and this was explored back in Human Services Committee back in the spring of this year. The number that we have from the SHA doesn't include capital, right? So we are comparing a little bit apples to oranges in terms of cost. But Sam, you asked about my vision, and I guess my vision, and we talk about whether it be for breast health, whether it be for family medicine, whether it be for any of the other surgical operations that we provide in Saskatchewan, the more that we can train providers locally, which is I'll get to that in a minute, then that means we have a better chance of keeping them here in Saskatchewan and then making sure that those services are available right here, close to home for people. I talked about the fellowships that the two breast radiologists had done in Ontario with the support of the hospital's Regina Foundation. We recruited them back to Saskatchewan, working with the College of Medicine here at the University of Saskatchewan right now to set up a breast fellowship program here in the province. And again, I think with the Regina Breast Health Center and the Saskatoon Breast Health Center, we have an opportunity in this province to be a leader across the country in terms of really expertise. And I've had the opportunity to talk to radiologists from other provinces who have seen what we're doing in Regina, and I think they're quite surprised and quite impressed with what we're able to do in Saskatchewan. And so I see that as a bit of an opportunity to become a leader in this space.
My next question was going to be about medical radiation technologists who perform mammograms because it is specialized. Would you say that recruitment efforts are going well aside from HRF's involvement? How are you recruiting these people? Is it more money? Is it more benefits? Like, how are you keeping these people here?
Yeah, so I'll just to be clear, Sam, HRF helped with on the breast radiologist side. For MRTs, MRT recruitment has been a challenge provincially, not just on the breast health side, not just in Regina, but in other communities as well. We're constantly reviewing our incentive packages available to MRTs, to set up shop here in Saskatchewan. We have been working pretty closely with our educational partners as well in this space. Sask Poly is a major one for us in the province in terms of training MRTs, but we're also recruiting globally and also in North America as well. Our Saskatchewan Healthcare Recruitment Agency has been at several events focused specifically on MRTs recently. Again, working on building some connections with people who have connections back in Canada or Saskatchewan, talking to them about the opportunities that exist here to practice, and then sharing with them the incentive packages that we have.
Before I talk, I'm going to take the specifics out of this shortly, but I really want to be clear. What are wait times like right now when it comes to a person's discovery, concerns, to diagnosis and treatment? I know there's an ideal, but what is the reality?
Yeah, so the last numbers that I have, Sam, for screening appointments, most locations around the province are within a couple of weeks. Again, that can vary, but most locations around the province are within a few weeks. Once you get into diagnostic, again, it can range from a couple weeks to 6 weeks, for example. And then once we get into if you do need a breast biopsy, that right now our urgent biopsies are 2 to 5 weeks wait time, roughly right now.
And what is the ideal wait time? What is the ministry working toward?
Well, I mean, when I think about it from a patient's perspective, the ideal wait time for any patient is tomorrow, right? And I think that's just trying to put yourself in the patient's shoes. The sooner you can know, the better. I think, ideally, we want that screening appointment to be, again, where we're at right now. I think I'm relatively comfortable with that, although we still have some work to do there. On the diagnostic side, I guess what we're trying to do is balance that load across the province. So if we have a longer wait in Yorkton and a shorter wait in Moose Jaw, then can we, communicate with patients better to say, hey, we have capacity sooner in Moose Jaw. Let's go there. We've also brought in some community providers in Regina, both Mayfair and Prairie Skies, to help with that as well on the diagnostic side. That has actually dramatically reduced diagnostic wait times in Regina. And again, as we get closer to that contract with our Calgary partner expiring, again, having that extra capacity in Regina is key to making sure that as many people as possible can stay close to home.
Okay, let's talk about mammograms then too. One of the concerns we heard from cancer patients who'd recovered is that they need regular mammograms to make sure they're staying cancer free. And then the government lowers the age of people eligible, which then adds more people to those eligible for mammograms. What is the wait time for a mammogram right now in the city versus rural areas? And how are you addressing that?
Yeah, so as I said, for the screening, mammograms, we're all within a couple weeks, pretty much around the province. And again, I was looking at the bus. The bus is currently the mobile bus that we have online right now. I believe it's currently in Nipawin this month, and then going off to Tisdale and Melfort. So women in the east central and northeast part of the province have an opportunity to visit one of those communities. We got the second bus starting again in January. So it's really and again, the diagnostic side, we're 1 to 2 weeks to 6 weeks wait currently for urgent cases. Again, when I come back to it, Sam, it's all about. Sorry, just to answer your question, Sam, I'll just say, I've heard some concern that lowering the age is going to jam up the system more. But I think we have to walk and chew gum at the same time, right? We have to continue to expand capacity to keep up with those routine mammograms, but then we know how important early detection is. So for those women who are 40 to 45 right now, who will now be eligible to be part of the screening program over the next year, I think we owe it to the women of that age in the province to make sure that they have access to screening mammograms. So if there is something concerning, we can catch it sooner. And just with the advances that have been made really in cancer care across the country, the earlier we can catch things, the better chance that we can give Saskatchewan women the best chance to beat this cancer.
Part of your job is being the complaints department. What are you hearing from the public?
On breast health or in general?
Let's start with breast health, but you can tell me what you're hearing in general too.
Yeah, I think in breast health, there's some positivity around there, just in terms of. I'll start with the positive. I think there's some encouragement around having the breast health center open. I've had a few people close to me walk with their family members through breast cancer, the beginnings of a breast cancer journey over the last several months, and so again, getting to hear their family's experience, both in the Saskatoon and Regina Breast Health Center, very positive. People feel like their needs are being met there, and so that's encouraging to me. I think what I hear though around the province on this case is just as much access as we can provide to people, and then communication. Communication in the health space, I think, is always so important. And again, something as simple as, hey, if I'm in Yorkton, and the example I gave earlier, and I got to wait 6 weeks for a screening mammogram or a diagnostic mammogram, pardon me, but I can drive over to Moose Jaw and get it done next week. That's the kind of communication that patients want more of, and certainly that's what I'm pushing both the SHA, the Cancer Agency, and all of our community partners is, let's make sure that we're constantly communicating with patients to give them all the options that are available to them.
Do you feel like, as a minister, you have the power to address concerns? I mean, you are one person. There is the SHA, there is the Cancer Agency. Are you able to actually move the needle on some of these concerns, or is it just listening and making people feel heard?
Well, I think, whether or not I'm able to do anything, listening to people and making them feel heard, I think is just the baseline, that I try and bring to my job every day. You're right, though, Sam. It's a big system. It's a big system. There's lots of moving parts. You pull one lever, and then you find some other challenges after you've pulled that lever. But I think what I say to people when I'm touring around the province is, unless I know about the challenges, I'm not going to be able to do anything about it. I'm not going to be able to ask the right questions. And I think that's really why I spend my whole summer touring around the province in different communities, talking to patients, talking to providers, trying to understand that. I do feel like we can make a difference. I do feel like, especially in this space, and again, it's not just me. I think about the providers that are specifically at the Breast Health Center, the work that they've done to pull that together, and a lot of it driven by feedback that we've received from patients in southern Saskatchewan. So I mean, credit to them for bringing issues forward. And then from that, we've been able to listen to those patients and then be able to make plans that are going to meet the needs of future patients in southern Saskatchewan specifically. And I think so. To your question, if differences can be made, they can, and we're seeing that live in Regina as we speak, and I'm optimistic we're going to see more of that.
You have a lot on your plate with a health portfolio. Breast cancer is just one of many. There are so many other health concerns, especially with an aging population. When it comes to your priorities for the ministry, what are your top 3 focuses right now?
Number one, primary care access for people around the province. I think it's so important, whether you're whether you're concerned that you might, be walking down a breast cancer journey, or whether you just have another health issue, having access to a primary care provider is priority number one for me. Priority number two is really around surgical output, expanding surgical output in the province, so that whatever that surgery that you or a family member need, you're waiting a reasonable amount of time for that surgery, and we can do that surgery as close to home as possible. Not every surgery needs to be done in Saskatoon or Regina. We have excellent surgical teams in Humboldt, in Yorkton, in North Battleford, in Moose Jaw, in Lloydminster as well. And then, the third priority is really around expansion of urgent care services in different communities. Another urgent care center coming in Regina, one being built in Saskatoon. We'll be doing a second one there, and then in North Battleford, Prince Albert, and Moose Jaw. And those centers are really targeted at reducing the strain that we see in our emergency rooms. And part of that is a bit of a public education shift that I think will need to happen over the next number of months and years is, okay, what am I going to go to urgent care with? What am I going to go to the emergency room with? And again, lowering the wait times in emergency rooms is really part of that, but then also ensuring that people really get access to the right care. And then the last priority is really around when it comes to mental health and addictions. And I know this is more Minister Carr's file, but her and I work very closely on this, is really implementing a recovery-oriented system of care in this province and making sure that the most comfortable place for somebody who's struggling with mental health or an addiction isn't the sidewalk in downtown Regina or Saskatoon, but it's a provincially funded treatment bed somewhere in the province, and giving them people access to that, and then really the incentive to recover and then go back to their families, go back to their communities.
Okay, I want to just go back to something you said about priorities and urgent care. There's a second urgent care center coming to Regina.
We're an early planning on that, yes.
But the first one is still not operating at 24 hours and occasionally closes. Is it wise to open a second one when the first one isn't operating 24/7 like it was supposed to?
And I talked about this a couple months ago in Saskatoon. It's not the priority of our government right now to open up to 24/7. We're not seeing necessarily the need for that. When we look at the overnight presentation numbers at both Pasqua and general emergency rooms, we think we can handle the overnight capacity in those two facilities. And I think, listen, we hear about staffing challenges all the time, so we have to be judicious about how we use the staffing resources that we have. And I don't think it would actually be the best thing for us to try and staff 24/7 at the urgent care center based on the numbers we've seen. If that changes down the road, yeah, we'll absolutely look at it. But I think what I've learned in this file so far is the priority when it comes to urgent care services is not 24/7. It's actually opening up more access points, whether that be in a city like Regina or Saskatoon, or whether that be in my community in North Battleford, is giving people another avenue to access care. Maybe they have something that doesn't need an emergency room doctor, but can be seen by another physician at an urgent care center, looked after quickly, and then they can go home. And then we can leave the more acute cases for our emergency rooms.
Okay. And in terms of, my question, it baffles me a little because I know that we've closed the urgent care centers because we don't have staff. We know that nurses are burnt out. And I'm just wondering how you're going to fill another urgent care center in Regina, the one in Saskatoon. It just seems like a need for a lot of people that we can't even balance the stuff that we have.
Well, I think when I look at what we're doing across the province, a newly renovated hospital in Prince Albert coming online, the new urgent care center in Saskatoon, as you outlined, new long-term care facilities. I was up in Larange a few weeks ago. We are going to have significant need for more healthcare workers in this province. And I think that's exactly the challenge that we're trying to meet with both our educational partners, with our union partners in the province as well with our professional association bodies for nurses and LPNs and CCAs all across the province. There is going to be an incredible need for more healthcare workers in this province. We recognize that, but the reason that we need that is because we're trying to provide better access for Saskatchewan patients. And so I think that's just because it's challenging doesn't mean we should be trying to do it.
Does that mean you're going to be adding more seats to the medical college, to nursing seats, to LPNs, to CSAs, to all of that?
Absolutely. We've been adding now for the last couple of years. I think ever since we first released our Health Human Resources Action Plan way back in 2022. Seems like a decade ago, but we've been expanding seats in virtually every medical program since that time. Earlier this summer, I announced 5 new residency seats in the family medicine program in rural communities. So Yorkton, Melfort, and Nipawin. This is all about, again, training. If we train a family physician in Nipawin, they have an opportunity to do their residency for 2 years there. They have an opportunity to engage with that community, understand what they might be seeing as a family physician in Nipawin or the northeast part of the province. And we think we have a better chance of retaining those physicians. And, the numbers bear that out in other communities where we have residency programs. And again, I mentioned earlier the College of Medicine, the work that we're doing with them to hopefully get to a breast fellowship program here in the province. My collaboration with the College of Medicine has been just fantastic over the last couple of months. Again, looking for opportunities where there's need in different parts of the province or in different professions, and then starting to attack that and create better capacity. And hopefully more opportunities for Saskatchewan kids to get into the College of Medicine and choose really, I think, what is an excellent career here in the province.
I feel like I could keep you going for probably another half an hour, but I know I am being cognizant of the clock. Thank you so much for your time today. I really appreciate it.
Absolutely. Anytime, Sam.